Hi, today we're going to be talking about meconium aspiration syndrome in post-term pregnancies. So first let's talk about what is post-term. Post-term is anything that's over 40 weeks. If you are pregnant and you have reached the 40-week mark and beyond, then you are considered post-term. Post-term pregnancies can be extremely dangerous. The reason being is because the placenta, which is the organ that provides nutrients and oxygen to the baby, starts to get a little bit old and stale. It actually stops working after a certain period of time. When that happens, the baby gets into fetal distress. If the baby doesn't get enough oxygen, then it starts stressing out. At that point in time, over 40 weeks, the baby's digestive system is actually pretty mature. And by that point, meconium, or the baby's first stool, first bowel movement, will come out while still in the womb. That's usually not what is supposed to happen. Usually, the baby's waste or feces will go through the placenta and the umbilical cord and then out mom. However, once baby is post-term and the digestive system is matured, it can happen where the anus actually relaxes so much that the feces will come out. That usually typically happens in scenarios where the baby is in stress, and that can happen, like I said, back full circle in post-term pregnancies. When meconium comes out, it is dangerous. And the reason being is because the baby can actually aspirate or swallow, breathe in the meconium while still in the womb, and that can clog up the baby's lungs. Of course, once the baby comes out and the lungs aren't cleaned out properly, then the baby can choke and not get enough oxygen, which can result in a host of issues such as brain damage. Therefore, if there is any issues that arose with the baby after 40 weeks through labor and delivery, it could be that you have a birth injury case. If you have more questions or want to talk more about your post-term pregnancy, please give me a call. My name is Adam Funk, and I am a birth injury lawyer.